Good day from Chem Help ASAP. Let's explore the different common routes of administration that are used for various drugs. Upon completion of this video, students will be able to list common drug administration categories and describe bioavailability across multiple routes of administration. There are many ways to categorize routes of delivery or routes of administration. My emphasis in these materials is for orally delivered drugs. Oral drugs fall within the category of enteral delivery. Enteral drugs are administered via the GI tract and would include typical tablets and capsules, sublingual drugs that dissolve under the tongue, and even suppositories. Parenteral drugs are administered by injection. That would include intravenous, IV, intramuscular, IM, and subcutaneous, SC injections, among others. Both enteral and parenteral routes of administration lead to a drug entering the general circulation for systemic circulation of the drug. Other broad categories include transdermal delivery, often in the form of a patch, and topical delivery, could be a skin lotion or eye drops. Transdermal delivery typically leads to systemic exposure, while topical delivery does not. Here is a CP time curve that is representative of many different routes of administration. This could be a CP time curve for an oral drug, often called PO, per os, through the mouth. At the start of the dose, there is a delay as the drug is absorbed along the GI tract. CP builds and then falls as absorption decreases and elimination takes over. A drug administered by intramuscular injection would appear similarly. The drug's appearance in the general circulation is slowed as the drug must diffuse through muscle tissue and enter capillaries. Likewise, drug from a transdermal patch has slowed absorption because of the need to cross various dermal layers to enter circulation. Just as oral absorption is often not complete, so oral bioavailability is typically less than 100%, bioavailability via IM and transdermal delivery are also normally less than 100%. IM and transdermal delivery do not face the hepatic first pass effect, as they are not absorbed through the GI tract, but IM and transdermal drugs can break down or undergo metabolism in muscle and skin, respectively. Bioavailability for IM and transdermal delivery is determined in the same way as oral delivery. Compare the AUC value for the alternate delivery to the AUC for IV with correction for the mass of the dose as needed. Whichever route of administration is chosen for the drug, the goals are the same. The route of administration must match the properties of the drug. Most biologics are not sufficiently stable to survive enteral administration and must be injected. Some drugs do not cross membranes for oral absorption. The route of administration must match the needs of the patient and disease. If a patient has trouble swallowing pills, such as a pediatric patient, then an oral solution may make more sense than a tablet or capsule. An injected drug may require supervision from a healthcare professional. Finally, and most importantly, the route of administration must deliver the therapeutic levels of the drug to the patient. This is often called efficacious exposure, adequate CP levels for a sufficient amount of time to provide the therapeutic effect of the drug. We have listed some ways to classify routes of administration, namely enteral, parenteral, as well as topical. We've also established that the concept of bioavailability is not limited to just orally delivered drugs. That was a very quick review of some of the most common routes of administration for drugs. If you have any questions, please do not hesitate to ask them in the comments section. Take care.